Good afternoon and welcome to our OakBend Medical Center Happy Hour podcast. My name is Donna and I am your host. I am so excited to welcome Dr. Sarfraz Aly. Today, Dr. Aly will be talking to us about what happens after COVID. He was very instrumental in leading the COVID team at the OakBend Medical Center. With over 17 years of experience in the medical field, Dr. Aly is a board-certified internal medicine physician who specializes in infectious disease. Dr. Aly offers several services including infectious diseases, diagnosis and treatment, annual physicals and vaccinations, travel immunizations, consultations, burn and wound care therapy, consultations and services. He also has two offices, one in Sugar Land and one in Morton. And after this podcast, we'll be glad to give you contact information. Dr. Aly, welcome, and thank you for joining us today.
Thank you for having me, Donna. Thank you for the great introduction.
Thanks. So, you were so instrumental in leading the COVID team at OakBend during this whole ordeal and guiding the staff and very instrumental in keeping the staff and patients safe. So we don't know the long-term effects of COVID. However, if I had COVID, do I need to follow up with a physician?
So you're right that we've done a great job at OakBend, and we've done a tremendous job in trying to secure the patients, secure the staff, the nurses, the doctors as much as possible we can. We are learning about this virus day in, day out. We get new information, new ways, new patterns that we see, new side effects. Basically, every single symptoms that we initially thought, there's new symptoms that are getting brought up every day. So in reference to your question, patients, most that end up in the hospital are having some sort of respiratory distress, some sort of viral pneumonia. And the long-term consequences, we don't know yet. So it's instrumental that you do follow with your primary care physician, with your pulmonologist, whoever that was within the hospital stay, with myself, infectious, or anyone that is there that was taking care of part of you. Because as you move forward, we also move forward and to see what happens, what goes on with your lungs. What the prediction at this point is that most patients will have some sort of a restrictive or constrictive lung disease as moving forward, especially those one that had COPD, congestive heart failures, or any secondary diagnosis prior to entering the diagnosis of COVID. So it is needed. And it's needed in the sense that most of these patients do get sent home with oxygen treatment. So somehow we need to wean them off the oxygen as well.
Okay. And then I've heard there can be residuals with maybe your heart and with your kidneys and those things. So it would probably be a good idea to follow up either with your primary care physician or one of you that treated them during the COVID time.
Absolutely. I think primary care physician is probably the key element because he's the one who leads the pathway to all of us. Now, if and when the patient gets discharged, they follow their primary care. Most of us have set up dictation methods that do get all our notes and our discharge summaries to the primary care physician. So somehow he is in the loop of understanding what's been transpired with this patient. So he would be the key player in this that would tell you, hey, yes, come and see me first. We'll make the arrangements, we'll make the assessments, the treatment needed, and to follow with each consultant to make sure that your heart, your lungs, your kidneys, your organs that were compromised during the treatment get back to normal. Or if they don't, at least they're followed very closely so they don't deteriorate anymore.
I think that's great advice because we often feel better and we think we're okay and something can come up later down the road. So if I've had COVID, can I get it again?
So there's a handful of case studies that have been reported from China, from different parts of the world, that patients who have had COVID have overcome the initial COVID symptoms, and they've tested negative on a number of occasions, do relatively well, and somehow they catch a second strain. So there have been cases. I believe last when I reviewed it, there were 4 cases that were in the world. I'm sure there are more, but we're not picking them up, I'm sure. But yes, the answer to your question is yes, you could get it. Most patients that we see in today's hospital stay are the ones that are initially COVID. We get them better. We do have a negative PCR, a negative antigen test that comes back to get them off the isolation if they're sick enough. And they go to a step-down facility where they get tested again. And all this is a testing phenomenon that some tests pick them up, and those that do viral shedding get picked up again as positive COVID. However, those are not reinfected. They're just dead virus shedding the virus particles, so that's being picked up. I've personally never seen it, but I've read case reports on it, so I'm sure it exists out there. I'm sure we're going to see it. I just don't know when.
Good. So we want the general public, I guess, to understand just because you've had COVID, don't assume that you can't get it, that if you get sick, you probably need to see your physician.
Absolutely. I think the vital role of physician is needed in this because, A, you don't want to take this lightly, and B, your physician is your key element to tell you when is it safe, when is it right, what is the waiting period on this, because a lot of patients come to my clinic and said, hey, I'm feeling respiratory distress, but I'm okay. You know, learning about this disease and illness, we don't know when the turn will occur, and the turn occurs in minutes to in hours before you're doing okay and you require some oxygen treatment. So it's better to be safe and go to your physician, get their advice, because they have seen cases after cases and know the pathophysiology on this virus and what it could do.
Okay. We have the holidays coming up, flu season, people moving around more. What advice do you have to keep people safe, or as safe as they can be kept over the holiday seasons?
So the advice is what we tell people when we tell patients: social distancing, keeping yourself. I know this is the time that needs that everyone's going to get together. Thanksgiving's coming, Christmas is coming. There's family get-togethers, holiday parties. I would strongly discourage that because, A, we know that this travels when you're in close confined space. We know that when you're with friends and family, you let your guard down so your mask comes off. I think this year everyone needs to be careful because we don't know with the flu season coming in, mixture of flu and COVID-19, how bad can it get or how bad will it get. I just think it's better to stay home, stay safe, stay in a close confined area with your family, not close friends, but nothing more than what CDC recommends, 8 to 10 people, but nothing more than that. I just think that if you get yourself into a big area, in a close confined area with a lot of people, you're going to get into trouble. One person can spread the disease to many other.
Right. And then what instruction do you have? Because some people now haven't seen their families in a long time or feel like, I just got to get out of the house. I'm going to start traveling abroad or traveling. What are your recommendations?
So my recommendation is that everyone, whoever's traveling, know where they're traveling to, who they're traveling with. And if it's a plane ride, know the chances, because just like you who's frustrated, there's so many other people frustrated. They want to get out. They want to do the same thing. We know that COVID exists, and COVID exists in asymptomatic patients. It doesn't mean that you cannot transmit it to anyone else. Just because you're asymptomatic, you still can viral shed. You could still transfer the disease to someone else. So I strongly encourage you to read the CDC guidelines and CDC recommendations. Look at the news, what state, what country, which one is at what alert zone, and judge for yourself. I really think that a lot of people get second chances with this disease who are asymptomatic, but some that we've seen, they don't get a chance to fight. They don't get a chance to survive this disease. And so it's one of those things that if you could stay home, stay safe, call their loved ones on Facebook or tell them on FaceTime or see them on the video chat. I think that's safer this year than any other, because I'm sure as the government, as the CDC, as the NIH, everyone's working on the vaccine. Something's going to come down the pipeline. It will make it better for all of us, and that will be a safer time.
Yeah, it is difficult, and I want the greater public to know it's not just difficult with the patients and everyone else. These doctors and nurses and hospitals get inundated, and we want to be able to take care of everyone. So please be safe out there. So I have found out a little tidbit today, but I'm going to let you talk about it, Dr. Ali. When would a patient need to see an infectious disease specialist and why?
So in COVID crisis and COVID relationships, I would encourage you that first get tested. If you're tested and you're positive, you're asymptomatic, you're welcome to do a telemedicine visit, because we want to keep our clinics, our people, our nurses free of infection as well. And we do telemedicine visits every day. Myself, my nurse practitioners, we do it 5 days a week, 8:30 to 5:30. We're happy to help. We're happy to assist in any way that we can. If you are having active symptoms, you're welcome to call, but my recommendations would be going to the ER, going to an urgent care that can capably keep you isolated as well as protect the environment that they're working in. Second reasons, ID is naturally, we're here to help any primary care physicians out if they get patients that are complicated with pneumonia, complicated with any kind of infectious process. We see patients from 18 years of age to elderly. We see everyone that has complicated cases that just needs a primary care, needs our help to assist them. We have a range of 3 physicians, 2 nurse practitioners that we see, from hepatitis to travel medicine to pretty much anything, everything. We do infusion services. We do a lot in our clinics. So we are thankful for OakBend, thankful for the community that we do see a lot of patients, and anyone that we see, we always relay our information to their primary care physician just to give them an update that, hey, we are helping you, we are working with you, we're trying to get this patient better.
There is one thing I want to talk about, and it's just a little bit off topic from COVID, but I think it's really important because we see a lot of it, and that is diabetic wounds, vascular wounds, those kind of things, and you are very instrumental in that also.
We have a clinic at OakBend that's a wound care clinic that's there with hyperbaric treatments. We have advanced modalities that we do see patients. Now, diabetes is a long-term complications and long-term disease process that people live with. And not just diabetes, but any other disease process that carries them to have wounds in there. I've been wound certified for past 13 years. I've been doing wound care at a wound care center for, I think more than 13 years. Hyperbaric trained. We do anything from a simple wound to basically big complex surgical wounds that we help patients get better, get back to work, get back on their feet, and do whatever we can. And it's just not us. We have a team of physicians and hospital that helps us do vascular interventions. We do advanced modalities. We have skin grafting. And then dire needs, we could do hyperbaric treatments that help out patients to have increased oxygen requirements into that wound bed. That helps the healing process. So I've been doing it. It's part of my favorite work in infectious disease is that, because it's satisfying when you see a patient who could not walk, who could not do things that they do because of cosmetic reasons, because of pain, because of just drainage or infection, that they get better, they get back on their feet, they're back at work, because that's what you need. You need to get out, and being in COVID environment, you're always stuck at home. But even with stuck at home, we encourage patients that, hey, put your mask on, take a walk outside your neighborhood, socially distance from the neighbors, but still get the fresh air. And some people with these wounds, they can't. So we thrive to do that. And honestly, it's a rewarding field. So it helps out.
At what point in the wound do you feel like someone would need to get seen? Because, a lot of people get a lot of wounds and they'll get red and they'll get festered, but they'll treat it themselves and it can get away from you real quick.
So I think any wounds that you see, you should talk to your primary care physician because, if it's a simple scratch, that's manageable at home, but if it's a complicated wound with the underlying disease such as diabetes, high blood pressure, kidney disease, any kind of heart failure, any kind of vascular issues, especially if you're bedbound or have decreased mobility, then you need to see your primary care physician. I'll always encourage, we've always had meetings with primary care physicians that we're here to help you because some of these wounds can get complex. They need more than one or two. We have several physicians within our wound care practice network that are engage and help us, such as vascular, such as cardiac, such as podiatrists. We have all these different physicians that sit in the same center, so we could have more than one eye looking at it. So the longer the wound stays untreated, or you fester with it more, or you try to treat it yourself, the more complex it gets for us to treat. The sooner they could bring it into the clinic, the sooner one of us could get an eye on it. Patients don't know, primary care physicians don't know that the things that are out here that are advanced modalities to treat may be so simple that can get treated within a week, and it would save the time, the cost of the healthcare, cost for the patient, time consumed for the physician. It's a safe environment for everyone.
That's great, and great knowledge to know about taking care of things sooner because you can do things to prevent it. Dr. Aly, I want to thank you for being guest here, and I want to thank you for all you've done for the community during this COVID crisis and everything else. I hope our listeners have learned a lot. Is there something else you'd like to say that you'd like our community to know?
Absolutely. I would like them to understand that we, as physicians, as a hospital team, we don't have answers to all the COVID, but if you do have symptoms, I encourage you, if you are concerned, I strongly encourage you to seek your primary care advice, as well as come to the hospital ER. And if you just needed just a second assurance, that's what we're here for, because the last thing you want to do is come here when you're really sick and when we are overwhelmed with the responsibility of you. So if it's early, all the OakBend primary care docs and all of us provide telemedicine visits. And so we're always available. Just pick up the phone and give us a call. It's better to be safe, understand what's going through versus figuring out in the middle of the night. As well as from the wound care and all the healthcare benefit standpoint, we're here. We're always happy to help you at the wound care center just to manage anything that you or the community has.
Dr. Aly, thank you so much for joining us today. I hope I can persuade you to come back and we can talk more. And a big thank you to our listeners for tuning in. Beginning now, set an intention and relentless focus on living your life as the greatest person you can be in all situations. Please join us next week for our podcast.
Thank you for joining us today on OakBend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.